Well, Medicare recipients all across the Bay Area have been bombarded with shipments of COVID-19 tests they never ordered.
And they have tried to stop it by complaining to Medicare. The folks have requested, in fact, that these unwanted tests not be covered by Medicare funds, but so far nothing has changed. Our consumer investigator Shannon Bacon first told us about these unusual shipments last month, and she continues to dig for answers.
Keith, Stacy, I want you to take a look at this. These tests were sent to one person's house. If Medicare is being billed for something you didn't order, it's fraud, and taxpayers are getting ripped off. So I went to the U.S. Assistant Inspector General to find out what's being done about these bogus claims. I know you're investigating the criminals, but are you investigating the people at Medicare who continue to pay these bogus claims? Before we get to that, let me explain how we got here.
This one is from Pompano Beach. Well, here's one from Illinois. Just ridiculous.
Robbie Baxley is one of dozens who called Better Call Bacon to investigate an influx of mysterious shipments of COVID-19 tests. His mother has received more than 50 test kits she didn't order, and Medicare keeps paying.
I've asked them if we could flag my mother's account, so if it's a COVID test, to just deny, but they say they can't do that. This one is 96, they pay 94.
Every box has 2, so, I mean, your mother will be testing every day.
I know.
Every other week or something, I get 2, 3, 4 tests in the mail.
It's infuriating to Al Ravenna, who used to investigate Medicaid fraud for a living, but now he can't put a stop to the tests he's receiving.
They just get that Medicare number and they just bang it, and as long as they keep getting the checks, they're going to keep doing it.
You may be wondering, how do these labs get your Medicare number? And why so many tests right now? Numbers are stolen through a data breach or just tricking you into forking it over. Medicare announced it would stop paying for the free COVID-19 tests as of earlier this month. Representative Kathy Castor says that fueled a last-minute shipping spree.
It sounds like they're dumping their inventory right now, billing Medicare, and they should not get away with this.
Castor followed up with this letter to federal regulators citing my reports and writing, I urge the department to act swiftly and strongly by not reimbursing these companies. So that brings me back to the OIG Assistant Inspector General for Investigations, Scott Lampert. So the viewers that have contacted us are concerned that they say they call, they complain, they don't hear anything. Are their complaints being taken seriously?
Every complaint we receive, whether it's on the phone, via mail, or on our website, is taken completely seriously, and we try and do our investigations as thoroughly and efficiently as we can.
Last month, the Department of Justice charged 18 people with COVID-related fraud, including 2 people in Florida, accused of buying Medicare numbers and submitting over $8.4 million for COVID tests. Do you expect additional arrests?
So I can't comment on that, but I will say that we have an ongoing number of investigations in this area. It certainly has our attention, and we are committed to stopping all instances of fraud involving over-the-counter COVID-19 test kits.
As for Medicare's culpability for paying despite fraud warnings, Lampert directed questions to other departments. Meanwhile, he recommends you look at your Medicare benefit statements closely.
If you don't recognize any of the services that are on that statement, call us up, give it to us. It helps us conduct our investigation.
As of May 11th, the federal government planned to stop paying for the free COVID-19 tests, and that should slow down the delivery of unsolicited tests. But the question remains tonight, how will these bills be handled, and will Medicare, as well as these crooks, ever be held accountable?
And you just brought over a few. This is a third of what you had over there. That went to one family from one company, and they didn't want any of them.
No. Didn't order them.
And what's the government doing? Are they trying to track down the companies that keep pushing this stuff?
Well, they're supposed to be tracking down these companies, and Representative Castor is now pushing the government to do this. She's pushing for the Department of Health and Human Services, as well as Medicare, to investigate these companies. I can tell you that the paperwork points to numerous companies in Illinois and in California, but I found one shipping address for a company in Hudson, and I went there today, and tomorrow I will be back here to show you what I found.
Wow, and these are all taxpayer dollars, so when people think, oh, it's just tests, it's not a big deal. What you've uncovered only scratched the surface. Can you imagine how many more are being sent?
That's right. The fraud investigator that we interviewed put it well. Nothing is free. It may be free to you, but it's not free to all of us, the taxpayers.
There's a price tag on everything, isn't it? Thank you, Shannon.
Thanks.